thought I'd wear the same shirt just so that actually you know who I am. It helps me too. God, what fascinating stuff. I'm taking you into a different place, which is around commissioning, update on commissioning policy in England. And my God, I thought, you've got all this interesting stuff to listen to, and now you've got somebody ripping on about this. I'm going to take you on a strange journey, because actually I'm going to be controversial. I'm going to try and say it. Might not believe what I say. I might be speaking with a forked tongue from a very particular perspective, okay? And it might be uncomfortable hearing to some people. Depends on your point of view. But keep calm and stay the course. We'll get there at the end. Right. Keep calm. We're in the recovery agenda. It seems to have been the voice that came from the NTA, the government, and the rest of it. And we had a little controversy about harm reduction, didn't we, a few years ago? And now we just try not to mention you guys doing that and let you do it away behind the scenes. And I'll come back to that. The other thing to remember is keep calm and an open mind, because from a different view, actually everything I say and everything I raise as a concern doesn't really matter, and it's all right. Hang on to one theme as I speak, which is the needs of the many outweigh the needs of the few. Unfortunately, you guys and I work predominantly with the few, and that's the impact of some of the public sector changes that are happening. There's a tagline there if you want to actually donate some money to Blenheim, and if you want to follow us on Twitter, it's @Blenheim CDP. I know nothing about Twitter. I had a wonderful intern from America who used to do it all for me. He's unfortunately gone back to America. Right. Three monkeys. That's really, the three monkeys really represents what I got out of the last 2 years trying to talk to government about my concerns about the changes that are happening. Oh, there's nothing wrong, I can't hear anything wrong, I can't see anything wrong, I'm not going to think anything wrong, I'm not going to mention tier 2. Unfortunately, there was a third, the fourth monkey, snake, whatever, who promised us lots of things about what was going to happen with the money for our sector, ring-fence money for drugs with and alcohol within local authorities, didn't happen. Then they told us it had really happened, that we just couldn't see it. And then Anne Soubry basically had to write to DrugScope and actually say, well, actually, no, you're right, it doesn't exist, but it'll be all right. So, do you trust politicians, senior people? Well, sometimes you can, sometimes you can't. Changes are all going to be positive. It's all going to be good, everything will go wonderfully, you know, all right, NTA's gone, but it's really going into public health and it'll make a lot of differences, and we'll be able to fight the agenda as we get in there. Wait and see. So, drug sector, really at a crossroads, and we've been at a crossroads for a long time, but we're still at the crossroads. You know, do we go, for organisations like mine, it's do we go down the mainstream route, do we go into some strange unknown place, or do we look for a third way? Wait and see. So what are the clear policy shifts? You have to excuse me, I don't have people to do my slides for me, so it gets a bit shaky towards the middle. Clear policy shifts to recovery agenda, community reintegration, service user-led provision. We've been on that agenda now since really about 2009, 2010. What's happening now is a debate about the priority alcohol and drug treatment should have post 2013 and 14. And actually, I have a message for you. Actually, we're no longer the priority. We are no longer the priority. If you look at the priorities of health and wellbeing boards, basically drugs doesn't even make the top 5, alcohol sometimes creeps into the top 4, you know, and one I read recently mentioned alcohol once, drugs not at all, but basically was really proud of the fact that the borough was basically just missed the medal points for syphilis. You know, and that's because of the agenda changes and what the priorities of public health are at a local authority level. I'm not saying anything is wrong. You know, it's from a sexual health point of view, that's really good. It's just really how your perspective and actually how drugs and alcohol work fits within the agenda. The other thing is that the UK government has been forced into the largest cuts in public sector funding in living memory. And guess what? You haven't seen those cuts yet because they've been holding off for the recovery. You know, local authorities have got to make huge cuts in their budgets going forward over the next 5 years. So as a sector, we can expect falling public sector investments, and in the coming years are going to be difficult, given the changing nature of actually the funding but also the fact we're no longer a priority and there are competing concerns. Yeah. The needs of the many outweigh the needs of the few. So, quick whip through some of those things. So, Public Health England, who, what, where, again, needs of the many. NTA seems to become some secret cell within PHE, and divide it up, and they're going to take them into back rooms and execute them when they can get round to it. Sorry to my PhD colleagues. These are things shared with me by some of your colleagues, basically, over a drink. They will remain nameless. You've probably shot them already. There's a transfer to local authority commissioning. That means a transfer to procurement. I'll come back to that in a minute, and that has huge implications for organisations. For some it's good, for some it's bad, but huge implications. Commissioning groups, well, we sort of like shot ECTs in the head, we shot strategic health authorities, we keep shooting bits of the NHS. I don't know why we keep giving control of the NHS to a group of body plumbers who basically run their own private companies. It's like giving plumbers responsibility for managing the water industry. Would you do it? No. We tried it before and it didn't work and we had to take it back. That's why we got PCTs, because we gave the plumbers the opportunity to run it and they made a complete foul up of it and we had to invent PCTs. It's confusing what, where, when, where's the democratic, where's the democracy in it, how do we have our input? Oh, I'll get off that because we need to move on. Localism, who, what, where. Recommissioning, there's been huge changes. Localism, everywhere's going to be doing their own thing. What does that mean? I'll come back to it. Okay, so we have the drug strategy, recovery, localism, holistic. Hidden within the drug strategy is something called DIY, do it yourself. It's called recovery. It's about service user-led stuff, which is all very good, but in the context of cuts, what it means is that's all you get. And sometimes some of the message coming out of the NTA before they went was that, service user-led stuff was the great stuff and sort of you can really afford it, pay for it yourself and go to rehab. Alcohol strategy, it says read the drug strategy for anything to do with basically treatment anyway, and they've done a U-turn on everything else that's in it, so you might as well not bother reading it because there's nothing in it. Possible exception of sort of intervention and brief advice, but basically, that's once every 10 years with your doctor. Anybody have one of those? Not worth the paper it's written on. Works programme. We, in our sector, all of us, had really good links on the ground with local providers who were actually doing a great job helping people that we work with get into work. Oh, along comes the work programme. Suddenly there are big 4, 5, 6, 7, 8 providers. Doesn't work. Allocation is all about basically their business interest, and basically surprise, surprise, feedback after feedback show that it does not meet the needs of our client group. Ooh. Police commissioners, they've got the DIP budget, the national DIP programme has gone. Luckily, for those of you involved, any of you involved in working in the criminal justice system, local areas have not sort of cottoned on to this yet. We're in that sort of strange place where it's gone, but it hasn't really gone. It's a ghost that's forgotten to die. I think with the changes to police funding, the police are going to be desperate to get their hands on that funding. And also, some areas are already moving it across to generic offender-based stuff that's nothing to do with drug-specific. Welfare reform is going to impact more heavily on our client group than probably any other client group across the sector. So, it's nice, and be positive. From a different perspective, it looks all right. Drug strategy. Let's just remind ourselves what the drug strategy said. So it depends on all drugs, including prescription over-the-counter medicines, needs of the many, and severe alcohol dependency. Within that, but I didn't put it in, it got really sort of good about sort of legal highs and the rest of it. It was sort of just deciding to announce a sort of like a turkey shoot, really. If it moves, shoot it, or try to make it illegal. Causes and drivers of drugs and alcohol dependency are complex, and personal solutions need to be holistic and centred on each individual. Anybody who's actually tried to sort of like relate that to the targets that we all get, we'll know how much of a forked tongue that little wording might be. No, the aspiration's right, it's just that it doesn't actually match with delivery on the ground and targets. Further, it states that it's important to design commission services which meets the need of all the community. Yeah, that's all right, that's good. Themes, you know, there were 3 themes, the usual one: reducing demand, restricting supply, building recoveries in communities. But the one in big, and the big message we all sort of got was focus on getting people into treatment, into full recovery, and off drugs and alcohol. That's what it's all about. We heard it. So, let's just move to Directors of Public Health. Directors of Public Health and local authorities are going to be responsible for health improvement at a local level. And they're going to do that via health and wellbeing boards. Okay, interesting. Local services are expected to take account of the diverse needs of their community. Okay. Back to the drug strategy. Key targets: freedom from dependence, prevention of drug-related deaths and bloodborne virus. I put that one in and highlighted that one because we're at an Eagle Exchange conference, so I thought it might be important. I'm not going to read the rest of those out. You all pretty much know them. It's sort of motherhood and apple pie, really. Okay. This is why I'm sort of being a bit different from the rest of it. I've sort of let some of the cat out of the bag already because I couldn't resist it as I was going through. There's an elephant in the room. I thought it was alcohol because for years I've run drug services and I thought those people with alcohol, they're going to steal my money. Actually, it turns out not to be alcohol, it's fat children. No, I mean, it's the health priorities. You know, it's when you look at the new responsibility on local authorities, it's tobacco control, it's alcohol and drug misuse services, it's obesity, it's physical activity, it's lifestyles interventions, it's dental public. I'm not going to read this all out. There's another whole page, look. Oh no, more. The issue is that our sector, drugs, you know, has all been lumped together with alcohol, so we're already lumped with a far bigger problem than the drugs problem. And then actually we have to fight with all these other agendas. And public health directors, time and time again over the last 2 years, have been in conferences and time again say, we can't wait for the changes because we're going to steal your money from drugs and we're going to put it into our other priorities. And if you look at health and wellbeing priorities across the UK, as I said before, drugs does not even enter the top sort of like 5. Alcohol sometimes struggles into the top 4. You know, what does that mean for our services? Comprehensive sexual health services are actually mandated in area. You know, the chief executive of Brook was basically on the news this week, basically complaining that they're facing serious cuts across the UK and the impact that that will have on sort of the rate of STIs. Right, take a breath. That's right, calm. Be all right. That's what they say. Okay. So previously ring-fenced funding from drug services has gone into a ring-fenced budget given to local authorities to fund public health. Fine, okay, so we've got to compete with all those other priorities now. It gets worse because actually that ring-fence potentially comes off in 2015, 2016. People only might correct me, I mean it's under debate. It's not there forever. So what happens when the public health budget has to compete with everything else that local authorities have to do, and they've got to make 30% cuts over the next 5 years? What does that mean for us? So, what's happening on the ground in local commissioning? You guys probably know better in your own local areas. This is really my perception of what's happening in pretty much London and not just the areas I work across London. So I'm biased, so this may not be what happens across the rest of the country. But in London, it feels a bit like the Wild West. It's a bit like all the rules have come away and who go around and public health in charge, local authorities are in charge, well, I don't know, well, you know, we'll sack those people, who shoots, it's last man standing. You know, some areas have actually sort of like sacked. Local authorities have sacked, got rid of, done things with their Director of Public Health they didn't like, you know, in those early days. Many of them have actually axed their commissioning teams. The drug action teams have gone down from 10 people to 1 person. As a provider, it looks a bit like this. You know. What's happening? Who did I talk to? Who's in charge? One area didn't even know, they were fighting. We spoke to 2 people and they both thought they were in charge. They both thought the other person reported to them. So what it means is, locally, aligned, locally led, will be free to design and jointly commission services to ensure they meet local needs of those in the criminal justice system and the drugs sector. What does that mean? Well, I remember when basically huge swathes of the country basically had an abstinence-only programme, so they didn't provide methadone programmes. You know, and I'm not that old, despite how I look. Competitive tendering and reward. Moving into local authorities means that services will be regularly re-tendered on a 3 to 5 year basis. It means that actually that the ability of services to embed themselves in community is severely impacted, and actually the investment that organisations will have in areas is going to be less, simply because they don't know whether they'll be able to hold on to them. I don't have anything against rewarding success. The trouble is it doesn't reward success. It rewards the winner of the beauty contest. So those issues are up. Okay, sometimes it looks a bit like capacity is a bit like, and that bears no relation to the fact my organisation works in Southwark. It's just coincidence that we work in Good news is that to the nice quality standard number 1 for drug use disorders is people should have injecting drugs access to needle exchange. Okay, that's all very well, but the bus for our needle exchange got cancelled this week and they forgot to tell us. So our workers turned up to go on the bus and the bus wasn't there. So now it's a walking bus. So just to rerun, money, no cuts yet really. Money, no ring fence on PHE going forward. You know, loads of threats there. Conclusion, this year's looking okay. Nobody's got much of a clue what's happening or what's going to happen in the future. Nobody knows what job they'll be in tomorrow. There's enough money at the moment. It's not been nicked by everybody else yet, but they're trying to get their hands on it. They're trying to break in through the door. We have the best services to support drug and alcohol service in the world. It's our job to make sure we protect them, and they're at risk. And we have one of the world's lowest HIV infection rates for injecting drug users. And that's because of the work that you guys do. Thank you.
Thank you so much.